This is the Emergency Medical Minute, sponsored by Health One.
So good morning. So one thing I just want to talk today about is blunt traumatic chest injuries. So obviously we live in the era of kind of the pan scan, which is any patient who comes in altered or any patient who has a concerning mechanism winds up getting a CT scan, oftentimes of the head, neck, chest, abdomen, pelvis. And then one thing we always talk about, are we missing, and the reason we do CT scans of the chest would be aortic injury. If you think of a significant mechanism injury, like a deceleration injury, fall from a height, major car accident, head struck by an MVC, and they're complaining of chest pain, and you do a chest x-ray and it shows no widened mediastinum, which is something that you can see if there's been an aortic injury. Any idea kind of how sensitive that is? Meaning, if 100 people come in with those symptoms and we do an x-ray on all of them, any idea how sensitive that is? It's not good. So it's only 75% sensitive. And if it's a low morbidity or mortality illness or injury, then we're okay with low sensitivity potentially, but it's not. Aortic injury is a high morbidity and a high mortality injury, but it's exceedingly rare. The aorta sits kind of in the mediastinum, and it's surrounded by a number of other structures, namely something called the ligamentum arteriosum. So those of you who have done NICU or baby stuff, you know about the ductus arteriosus. So that's where the left pulmonary artery, which has deoxygenated blood, right, coming from the right ventricle, going to the lungs, deoxygenated blood, connects to the aorta. It's a shunt. So that allows the oxygenated blood from the aorta to perfuse the pulmonary vasculature in utero. So that's called the ductus arteriosus. That closes in the vast majority of kids. It causes problems if it doesn't, but it closes and it turns into this little fibrous band of tissue called the Ligamentum arteriosum. And the reason that's important, other than being cool words, is that it helps hold the aorta in place. So your aorta is like a knob, it's an arch, right? It comes through your mediastinum as an arch, and just towards the end of that arch is where that ligament holds, and it holds the aorta in place. So when there's a major deceleration injury, meaning the structures of the mediastinum go pushing against the anterior chest wall, that's where you can have pulling on that ligament and disruption of the aorta and an injury to the aorta. So it's a serious injury. Requires operative repair, oftentimes endovascular repair. But you can't detect it with a chest x-ray, basically. So effectively, that's the reason why a lot of them get CT scans of the chest. But in a recent Annals of Emergency Medicine article, there is a decision-making tool called the NEXUS tool. You've heard NEXUS for C-spine imaging and things, right? It's a big study that looked at how can we kind of risk stratify these patients, and there are a number of criteria that we can use. That's all available on MD Calc that your docs may use that are involved tenderness over the chest wall. Are they altered? Do they have a serious mechanism? And it calculates a score about whether or not they could get away with just a chest x-ray to rule out what is an exceedingly rare but also exceedingly risky injury from a blunt thoracic traumatic mechanism. Cool? Does that make sense? Any questions about that? All right.
We are on a quest to provide the world with free medical education. Please help us out by rating us on iTunes, following us on social media, and subscribing to our newsletter at emergencymedicalminute.com.